Healthy People 2020 identify mental illness as being a leading cause of disability in the United States and one of the largest disease burdens here. Approximately 1 in 4 people in the United States have dealt with mental illness in the past year. In 2014, the state of Kentucky identified 7 health goals to work toward during the next 5 years. One of them being reduce the number of poor mental health days by 25% in Kentucky. Treatment with medications is effective in treating mental health symptoms, but relapse through noncompliance with prescribed medication regimen is common among mental health patients. Currently, there is a lack of use of evidence-based practice to guide interventions for psychiatric medication noncompliance. Psychiatric medications must be taken on a regular, continual basis to maintain therapeutic effect. It is imperative that mental health patients are taught the importance of medication adherence, and medication compliance methods are identified and utilized by practitioners. Advanced practice nurse practitioners should develop and implement additional patient training and ongoing patient education to ensure patients have the best knowledge regarding medication compliance. The purpose of this literature review and project proposal is to examine the effect of increased patient education on psychiatric medication compliance in existing evidence-based practice and create interventions to improve medication compliance in rural settings. A literature search was conducted using EBSCOhost. Databases searched included CINAHL Complete, Academic Search Complete, and Medline. Keywords used to narrow search results included rural, patient education, and medication compliance or medication adherence. The search yielded 33 results, which were further narrowed into studies that specifically highlighted the effect of increased patient education played on adult psychiatric medication compliance. There was limited research that specifically targeted mental health patients living in rural areas. All studies focused on increasing patient education and devoting more time to patient teaching. The methods in which the additional education was provided did vary between studies, but all studies yielded positive outcomes despite delivery of those methods. Utilizing the findings of these studies to improve nursing practice related to psychiatric medication compliance would be beneficial. Providing additional patient teaching in an outpatient setting ensures the provider will be able to provide continual education. Follow-up visits provide an opportunity to stress the importance of medication management and to deliver ongoing patient education. As indicated by the reviewed studies, increased patient education yields an increase in medication adherence. This additional education can be provided by the practitioner and all of their clinic staff. Implementing extra healthcare team members to provide increased education and support to mental health patients would be beneficial in improving medication compliance. More time and emphasis should be placed on promoting medication adherence. Ensuring the patient understands the importance of taking medications as prescribed is imperative to successful patient outcomes and the therapeutic effect of psychiatric medications. Ongoing education regarding medication compliance should be maintained to ensure patients continue treatment. Following current evidence-based practice and applying research to current practices ensures the patient receives the highest quality of care and has the best chance for a successful outcome. The project plan includes utilizing these research models as a framework to create an evidence-based intervention that will improve upon patient compliance rates in psychiatric clients living in rural settings. These patients, though willing to learn, have lower compliance rates because of lack of resources in the surrounding community. Fewer mental health facilities often means providers have a larger patient base, leading to less one-on-one time with the patient. The goal of this project is to increase the amount of time providers spend on patient education and to improve upon patient adherence. Adding increased education and self-management skills training on a routine basis to patient care will increase medication adherence. Only new patients will be included in the proposed project. These patients must have a mental health diagnosis and be referred to Crossroads Health Center, a rural outpatient clinic for psychiatric services, to be eligible for project intervention. Patients will receive additional education and verbal counseling monthly at each follow-up appointment. Patients will also receive weekly telephone counseling made by the clinic staff to follow up with the patient and to stress the importance of medication adherence with mental health. The patient will complete a self-report of medication adherence developed by Morrisky. The monthly data will be analyzed at 3, 6, and 12 months and compared using the Pearson correlation coefficient. The goal is to see increased medication compliance throughout the project, or at least see the patients remaining consistently compliant during the 12-month period. Costs for this project are minimal because staff implementing interventions will already be working in the clinic. The Morrisky questionnaire will be given by the provider at each monthly follow-up, and weekly phone counseling will be provided by an on-staff nurse. The budget would include cost of additional paper and ink to print questionnaires, around $200. Since these patients already receive care in the clinic, there would be no indirect costs that would need to come from the project budget. Project overhead, records, and any other indirect costs would already be coming from the clinic budget. Mental health compliance and treatment is an essential component to mental health patients. Lack of knowledge and support regarding the importance of adhering to the patient's prescribed medication regimen is imperative in reducing symptoms associated with mental illness. It is the responsibility of the provider to ensure patients are thoroughly educated on the risk of noncompliance. Implementing this project in rural mental health centers will hopefully provide evidence that programs like this one will improve patient outcomes and the patient-provider relationship.